EATC4C stands for the Experimental Arthritis Treatment Centre for Children. It was started in 2014, following an award by Arthritis Research UK, now Versus Arthritis, and funding from the University of Liverpool and Alder Hey Children's Charity. It is the first and only one for children in the UK. Its main goal is to improve the health and well-being of children. So let's look at each word to understand what we actually do at the EATC for children. E. Experimental. Experimental means simply we test new and different treatments for children, and there are different ways to do this. Studies may be based in the laboratory, where we look for biomarkers, which are molecules that occur naturally in the body. These biomarkers might predict disease flares or drug responses. We also perform early phase clinical trials, testing promising medicines that are often used to treat similar conditions. Our goal is to find and test better, safer medicines for children. A. Arthritis. Arthritis is just one of the conditions we are trying to treat. It is an umbrella term and actually includes a number of inflammatory, autoimmune and bone and joint conditions, including juvenile idiopathic arthritis, or JIA, JIA-associated uveitis, juvenile onset systemic lupus erythematosus, bone diseases and scleroderma. Most people don't realise that children can get these conditions too. TC, Treatment Centre. Although treatment centre implies a building, we are actually a group of people spread throughout the UK, in Liverpool, Bristol and Sheffield. Within this collaborative group, we train new doctors and scientists. We also partner with industry to trial new medicines in small patient groups, and collaborate both nationally and internationally. 4C, for children. Children and young people are at the heart of what we do, and ensuring that they remain at the forefront of our research is our number one priority. We work closely with children and their families to understand what is important to them. This means getting them involved in all stages of our research, including planning the studies, developing the patient information sheets, and even helping develop animations. The team of people that make up the EATC for children are based in 3 cities. Bristol is led by Professor Ramanan, Sheffield is led by Professor Bishop, and Liverpool is led by Professor Beresford. Liverpool is the main hub for the EATC for children, where we have a large team of clinicians and scientists working side by side. This is what makes the EATC for children special. The expertise of our team members and all of our different disciplines make us strong and able to produce effective research to improve the treatment and care of children. Some of our work starts in the lab. Our scientists are looking for molecules in the body that might tell us if you are going to get sick or when you are getting better. Then they look at ways to use these molecules to identify better treatments or tests. When new treatments are discovered, we undertake a clinical trial to test the treatment and show that it helps fight the disease. We might also perform a study to gather information about children with certain conditions. By learning more about the disease, its symptoms, and the children that get it, we can try and identify ways to treat it, which could lead to another clinical trial. The aim of all our trials and studies is always to make children feel better and improve their conditions in order to help them get back to school, friends, and family. All of the work carried out in the EATC for children is inspired by and involves all of our children, young people, and their families. Our team also takes research activities out into the community to inform and inspire the scientists of the future. The major aim of this EATC for children is to allow patients to benefit from new treatments, and the formation of this unique group means that we can take a huge step forward in using early translational and experimental medicine to treat childhood arthritis and related rheumatic and musculoskeletal disorders. Visit our website to find out more, our Twitter to find out about upcoming events, or contact us directly.